Have you ever gone to the doctor and suddenly forgotten every English word you learned? You know the words at home. You practice them. You feel confident. But when the doctor asks, "What's the problem?" your mind goes completely blank. You're not alone. Many English learners can order food, talk about the weather, or introduce themselves. But talking about health feels different. It feels more serious. You don't want to make mistakes, so the doctor understands you clearly. The good news is that you don't need hundreds of medical words. In real life, doctors usually use simple English. Patients use simple English too. They don't speak like medical textbooks. Today, you're going to listen to a natural conversation between a doctor and a patient. Along the way, you'll learn useful phrases, understand how real conversations flow, and discover expressions you can use the next time you visit a doctor. And stay until the end, because you'll also learn a few small expressions that instantly make your English sound more natural. Let's begin. Imagine you wake up in the morning with a sore throat. You have a cough. You feel tired. After 2 days, you decide to visit the doctor. You walk into the doctor's office. The doctor smiles and says, "Good morning. Please come in." The patient replies, "Good morning, doctor." The doctor asks, "What brings you in today?" Now, this is a very common question. The doctor is simply asking, "Why are you here today?" Instead of saying, "I came because I am sick," you can answer naturally, like this: "I've had a sore throat for 3 days. I've been coughing since yesterday. I haven't been feeling well." Notice something important. English speakers often use "I've had" or "I've been." These expressions focus on something that started before now and is still happening. Let's continue. The patient says, "I've had a sore throat for 3 days. I've also been coughing a lot, and I feel very tired." The doctor nods. "I see. Do you have a fever?" The patient answers, "Yes, I had a slight fever last night." The doctor asks, "Have you taken any medicine?" The patient replies, "Just some painkillers, but they didn't help much." Did you notice another useful phrase? They didn't help much. This means the medicine worked only a little, or not at all. It's a very natural way to explain your situation. Now here's something many learners do. They memorize words like influenza or respiratory infection. But native speakers often say simple things like, "I don't feel well, my throat hurts, my head hurts, my stomach hurts." Simple English is powerful. Now, the doctor wants more information. The doctor asks, "Do you have any allergies?" The patient says, "No, I don't." The doctor continues, "Have you been around anyone who was sick recently?" The patient thinks for a moment. "Actually, yes. My coworker had a bad cold last week." Notice the word "actually." It's a great conversation word. It gives you a moment to think and shows you're remembering something. You can use it in many situations. "Actually, I forgot my wallet." "Actually, I don't drink coffee." "Actually, I'm free tomorrow." Small words like this make your English sound much more natural. Now the doctor says, "Okay, I'd like to examine you." The patient answers, "Sure." The doctor checks the patient's temperature, then listens to the lungs. Next, the doctor looks at the patient's throat. After a few minutes, the doctor says, "Your throat is red, but your lungs sound clear." Here's another useful expression. Lungs sound clear. You don't need to remember this exactly. The important thing is understanding that doctors often explain results using simple language. Now, the patient asks an important question. "Is it serious?" The doctor smiles. "No, I don't think so. You probably have a viral infection. You should get plenty of rest, drink lots of water, and take this medicine." Notice the word probably. Doctors often avoid saying something is 100% certain. Instead, they say, "You probably have," "It looks like," "It seems that." These expressions sound polite and professional. Now the patient asks, "How long will it take to get better?" The doctor answers, Most people feel better within a week. If your symptoms get worse, come back and see me. This is another useful phrase. If your symptoms get worse, symptoms are simply the signs that you're sick. For example, a cough, a fever, a headache, a sore throat, a runny nose. Now here's something interesting. When talking about pain, English speakers usually don't say, I have pain in my head. Instead, they say, I have a headache, my back hurts, my knee hurts, my shoulder hurts. Natural English is often shorter. Let's look at another example. This time, the patient has stomach pain. The doctor says, hello, what seems to be the problem? The patient replies, my stomach has been hurting since yesterday evening. The doctor asks, can you describe the pain? Now you might be wondering, what does describe the pain mean? It simply means, tell me what the pain feels like. The patient says, it's a sharp pain, or it's a dull ache, or it comes and goes. These are very common expressions. A sharp pain feels sudden. A dull ache is weaker but lasts longer. It comes and goes means the pain appears, disappears, and then returns. Let's continue. The doctor asks, did you eat anything unusual? The patient thinks, yes, I ate some street food while traveling. The doctor asks, did anyone else get sick? The patient replies, yes, my friend wasn't feeling well either. Again, notice how simple these sentences are. Real conversations don't use difficult grammar. They use short, clear sentences. That's what makes communication successful. Now, the doctor says, you may have food poisoning. I'm going to prescribe some medicine. The patient asks, should I stay home from work? The doctor replies, yes, rest for a couple of days. Eat light meals. Drink plenty of fluids. If you develop a high fever, go to the hospital immediately. Did you notice another useful phrase? Stay home from work. You can also say, stay home from school. Very natural. Now let's talk about asking questions. Many English learners only answer questions, but good conversations also include asking questions. Here are a few useful ones. What should I do? Is this medicine safe? Should I take it before or after meals? Can I exercise? When should I come back? These questions are easy to remember, and they're useful in real life. Now here's where many learners make a mistake. They try to translate directly from their first language. Instead, learn complete phrases. For example, don't only remember the word appointment. Learn the whole sentence. I'd like to make an appointment. Don't only learn the word prescription. Learn, can I get this prescription at any pharmacy? Your brain remembers complete ideas much better than isolated words. Let's practice another short conversation. The receptionist says, do you have an appointment? The patient answers, yes, I have an appointment at 10 o'clock. The receptionist asks, could you fill out this form, please? The patient replies, of course. A few minutes later, the nurse says, the doctor will see you shortly. Notice that phrase. The doctor will see you shortly. It simply means the doctor will see you soon. Very common. Now imagine you're at the pharmacy. The pharmacist asks, how can I help you? You answer, I'd like to pick up my prescription. The pharmacist says, take one tablet twice a day after meals. You ask, are there any side effects? The pharmacist replies, you may feel a little sleepy. Again, these are simple conversations that happen every day. The more you hear them, the easier they become. But here's the interesting part. Learning English isn't only about vocabulary. It's about recognizing patterns. Notice how often people use phrases like, I've been, I'd like, should I, can I? These patterns appear everywhere. At the doctor's office, at restaurants, at airports, at hotels, at work. When you master these patterns, speaking becomes much easier. Now let's imagine one final conversation. The doctor says, "How are you feeling today?" The patient smiles. "Much better, thank you." The doctor asks, "Is your cough gone?" The patient replies, "Almost. I still cough a little in the morning." The doctor says, "That's normal. Keep drinking water and finish your medicine." The patient answers, "I will. Thank you for your help." The doctor smiles. "You're welcome. Take care." Simple, natural, real English. Now let's review the most useful expressions from today's conversation. What brings you in today? I've had a sore throat. I haven't been feeling well. Do you have a fever? Have you taken any medicine? It didn't help much. I'd like to examine you. Is it serious? You should get some rest. Drink plenty of water? How long will it take to get better? My stomach hurts. It comes and goes. Should I stay home from work? I'd like to make an appointment. I'd like to pick up my prescription. Take one tablet twice a day. Are there any side effects? I'm feeling much better. These aren't just vocabulary words. They're complete pieces of real conversations. The more often you hear them, the faster you'll recognize them in movies, TV shows, podcasts, and real life. Here's one simple challenge for today. Choose 5 expressions from this lesson. Say each one out loud 10 times. Then imagine you're talking to a doctor. Answer the questions. Ask your own questions. Even if you're speaking alone, your brain is practicing real communication. That's how confidence grows. Remember, fluency doesn't come from memorizing long lists of words. It comes from understanding real conversations. One useful phrase today, another tomorrow. Little by little, English starts feeling natural. One day, you'll walk into a doctor's office, hear, "What brings you in today?" and answer without translating in your head. You'll simply speak. And that's the goal. If you enjoyed this lesson, subscribe for more videos that help you speak English naturally and confidently. Keep practicing, keep listening, and most importantly, keep speaking. Your English gets stronger every single conversation.